I'm Dr. Katie Ball with Arkwright Veterinary Services. This is my little quarter horse mare Dixie. She's about 20 years old, and we're going to go over how to prepare your horse in case of an emergency and what to do during an emergency. So, first thing, try to keep the paws off of them. But get your horse used to having different areas of its body messed with. During an emergency, depending on what it is, the veterinarian's going to want to be able to check its gum color. Make sure it's nice and pink. So get your horse used to having its mouth messed with and played with. And then, you know, get her used to having her lip pulled up, and then, you know, we can take a look at her teeth. Obviously, this one's not used to it. She thinks I'm going to worm her, and she hates being wormed. But that's one thing you can do. Just play around with their mouth. You know, just stick your finger here in the corner and get them used to their mouth being messed with. Stop. You're all right. Another thing you can do is, you know, get them used to being poked. You know, just poke them a little bit like this, because more than likely when the vet comes to evaluate your horse during an emergency, they're going to have to give it a shot of some sort, whether it's going to be in the vein to give it some painkiller or in the neck to give it an antibiotic. But that's one thing you want to get your horse used to, is just being poked. You can just use your finger, just poke them around. Use a pen, you know, just take the point of a pen and just poke them. Just get them used to that. It helps an awful lot. What you can do too is, let me just tighten her up a little bit. Learn how to take a good heart rate, because quite often when you call, if you can tell the vet, you know, if you think it's a colic case, if you can tell the vet what their heart rate is, it can give your vet a good idea as to how severe it is and what might be going on. So you can just get a cheapo stethoscope. Doesn't have to be anything fancy. And typically their heart is on their left side, right in their armpit, right behind their elbow. So then, you know, find some sort of a watch or a stopwatch. A lot of people have stopwatches on their phone, which is really handy. And then just listen to their heart for about a good 15 seconds and count how many beats you hear in 15 seconds. And then just multiply by 4 to get your heart rate per minute. The other thing you can help is get your horse used to having his legs hosed off. Back there. Mine don't like to be hosed, so I'm not going to demonstrate it. But if they've got a leg wound, the first thing I'm going to tell you on the phone is wash their legs down. Just cold running water. It doesn't have to be a hard stream or anything, just a nice trickle of water, you know, just down their leg, you know, especially over the wound, to get it cleaned out real good. They say dilution is the solution to pollution. So, you know, get them used to the sound of the water. Get them used to the feel of it on their legs. Obviously, if it's the middle of winter and there's ice out, well, we got to do something different. But most of the time, you can get away with being able to hose your leg pretty good. Back up a minute. Another thing that really helps is to get your horse used to having his temperature taken. More than likely, you know, if your horse just isn't quite feeling right and we're suspicious it's a colic case, we always want to check, make sure they're not running a fever. So the more you can work with your horse at getting their tail messed with, getting their butt messed with, easier it makes my life as a veterinarian. What are you all jumping for? Stand still. So typically, you know, just scratch them around their butt. Quite often when you start to tickle them under their tail, they'll raise their tail. You know, get them used to their tail being messed with. You know, play with their tail, brush their tail. You know, take your finger and just poke them on their rectum. You get them used to the feel of that. You know, even invest in a cheapo thermometer, just something you can get at a human pharmacy, just a digital one. That'll work just as good. Make sure it's working. And then you can just slide it up in there. The digital ones usually beep when they're done. Yeah, obviously I don't do this very often to her. Good girl. She's a good girl. If you're using one of the old-fashioned mercury ones, leave it in for about a minute. That way you get a good core rectal temp. And it'll be accurate. Try to hold on to it while it's in there, because they have a tendency to like to suck it in, or else they'll spit it out, and then you gotta go searching for your thermometer. That's never a fun thing. Good girl. Good girl. You're a little on the warm side. It's hot out here today, isn't it? You're a good punky. Yeah, she's a good punky girl. Alright, so I think I'm pretty much done messing with her. I'm going to show you on Slick how to wrap a leg wound. He's much better about standing for his feet than she is. But those are the majority of things that you can do to help get your horse ready in case of an emergency. Yeah, so let's switch over to Slick. Let me grab a few things and we'll go from there.